May marks Mental Health Awareness Month, and this month in particular, it is so important for us to focus on this critical issue that has impacted every single person across this country and across this world in ways that are profound and overwhelming. I am joined today, and we will hear from soon, representatives from the Department of Health and Human Services, led by Dr. Krall, as well as Every Mind, led by Ann Mazur, Cornerstone Montgomery, Carrie Cho, and Ms. Helga Luest, Chair of the Mental Health Advisory Committee. These are remarkable individuals that represent so much of what is so critical right now, leaders who have stepped forward to ensure that we provide critical wraparound services to people who have been in crisis. And we know that based on CDC data, there are more than 40% of U.S. adults are struggling with mental health or substance abuse. We know that women and youth were the most impacted emotionally by COVID, and the suicide rate in the Black community has increased by over 30%. We know that our hotline here in Montgomery County answered 32% more calls, text messages, and chats than last year. And our hotline also conducted more than 10,000 suicide screenings, a 48% increase from last year as well. More than 66% of text messages and chats and 10% of calls to our hotline are from youth under the age of 24. We've also seen our children and youth experience an added stress and anxiety that is expressing itself in a number of different ways in our schools. And we have to, in addition to supporting these remarkable community-based organizations, do everything we can to support children, youth, and families and help ensure that we address some of those trigger issues that are leading to such mental health toll. This has to be an all-hands-on-deck approach, and this has to include every policymaker, every resident, every parent, every teacher, all of us working collaboratively together to support our families in crisis. So I want to especially thank and recognize the individuals, the behavioral health specialists. I've got one in my office, a clinical licensed social worker, and Beth Schumann, who are continuing their extraordinary work during extraordinary times. We know that many people are leaving the profession because of burnout. We know that fewer people are signing up for the profession because of burnout. We have to do everything we can to uplift this critically important work. There is no more important calling, especially right now. I'd like to now invite my two colleagues to say some words as well. I'll first invite Councilmember Sidney Katz, followed by Council Vice President Evan Glass. Councilmember Katz.
Thank you very much, Council President. Well said. You know, millions of Americans, as we all know, struggle with mental health, according to the National Alliance of Mental Illness. And 1 in 5 adults and 1 in 6 youth, aged 6 to 17, experience mental health illness each year. It affects all of us in every aspect of our lives, at every stage of our life. And in recent years, there has been an increasing acknowledgement of the importance in recognizing and treating mental health illness. There was a time it was a topic that families didn't talk about. Thank goodness the time now is that we do, because the first step in solving a problem is to admit to the problem. And that is exactly what we continue to do. And I too join our partners, and they are our partners, both governmental and nonprofit, in helping us help our communities. Many of you have heard me say I sincerely believe a community is a family, and our family needs help, and each of our families do. Their service to the county is absolutely essential. It's important to do things exactly like we're doing today, to recognize the work that they do, to remind all of us that we need to continue to fight to ensure that all residents receive the care and treatment they need. Thank you very much, Mr. President. I'm going to turn it, I guess, to Vice President Glass.
Good morning, everybody. The last 2 years have been an extremely difficult one for all members of our community. The economic anxiety, the housing anxiety, the food insecurity, it manifests itself. And we are seeing that stress play out in our schools, in our communities, on our streets, and it is because of our network of support exhibited by the incredible individuals and the organizations each of them represents behind me that we are working extremely hard to make sure that every person in our community receives the help that they need. This is the crisis of our time. The statistics that my colleagues shared with you underscore it, but each and every one of us know it. We know people who need help, and our kids are screaming out to us to get them that help. And I want to extend my deep appreciation for every single person behind me for the work they and their team members do to try to make our community whole. Thank you.
Thank you. And now we will hear from members of that team. First, we will hear from Dr. Raymond Krall, Director of our Department of Health and Human Services.
Thank you, Council President Albornoz. You know, this is, there's good news and there's bad news in this. And the bad news is that we are in the worst time of our history in terms of mental health and stress and anxiety and depression and risk of suicide and major mental health in our entire lifetime, and certainly in my career. The good news is that I have never before seen the numbers of people who have been willing to say, I need help. I need to talk to someone. I need to outreach. I need someone to talk to in this moment. The numbers of people who've taken mental health first aid in this county have been incredible, and I very much appreciate that and want to say thank you to the public who has done that and who's recognized that stigma can't stop you, shouldn't stop you, that we need to kill stigma, and the way we kill stigma is by talking about this with each other and with and seeking help when we need it. You know, there's a lot of fear about what therapy is, whether or not someone is going to mess with your mind. Therapy is a conversation between two people, and one of them has a set of skills that they bring to the table to help you find a better way of living and better mental health. We are all struggling. In the last 2 years, we have all gone through our moments of anxiety and depression and fear and uncertainty. These are uncertain times, and that is not anything to be worried about or to be ashamed of. It is appropriate to talk to each other. It is appropriate to talk to friends and family. It is appropriate to pay attention to what's happening with your friends and to reach out and to say, hey, look, you look like you're a little stressed. How are you doing today? You may be the voice that helps someone turn a corner at a desperate hour. And so don't be afraid to talk about it. There is no shame in talking about it, and there is absolutely, it's absolutely a statement of courage. I want to thank the teams who have gone, the providers over the last couple of years who went from sitting in an office to going to telehealth and telemental health to make sure that those services are available to the public and out there for you. My team in the Department of Health and Human Services has done that. The provider network has done that. They have also continued to work in person with people where it was necessary, despite the risks that it has posed throughout this over the last 2 years. So I want to thank them. Our hotline is incredibly busy and is a fruitful place to start a conversation if you need to. They can do a lot with you and a lot to help, and they can help you get connected to a deeper level of service if that's what you need. So I want to thank the County Council for their support, the County Executive for his support over the last 2 years. We have grown our mental health service system enormously. There are still challenges in terms of the numbers of people and in terms of recruiting, but we are on the job and we are working to give you every opportunity you can to get you the help you need to preserve and protect your mental health. So I want to thank you all, and thank you, Council President.
Thank you, Dr. Krall. Next, we will hear from Ann Mazur, Chief Executive Officer of Everymind.
Thank you, Council President Albornoz and council members. Appreciate your comments. I'll build a little bit on what Dr. Krall just mentioned and also what the Council President mentioned, that it's all hands on deck. And as Dr. Krall mentioned, people are reaching out more than ever, and I encourage everyone to be that person, to listen, to understand what's going on, and to act on that and help support the person. Every one of us in the community, I love the all hands on deck comment, can help support. And all you need to do is open the conversation and ask someone how they're doing. Also, as the organization Everymind that answers the hotline, you heard the tremendous statistics as far as the individuals that are reaching out and the suicide assessments being done. But I also encourage everyone to reach out if you're not in a crisis. A big part of the hotline is supportive listening. And also for individuals that need support in helping someone else. So if you have had that question with someone and you're not sure what to do, our hotline can help support you. So you can reach out and say, I talked to a colleague or I talked to a friend, and the hotline can help walk you through that. So those are the 2 points I would add. Thank you again.
Thank you. Next, we will hear from Carrie Cho, Chief Executive Officer of Cornerstone Montgomery.
Good morning, everyone, and thank you so much, President Albornoz. I would just like to thank everyone for the recognition, for the words that have been spoken. It is certainly true that the last 2 years have been some of the most challenging of my career, and it is just incredible to see the support that has happened, all of the resources that have been provided and figured out during this last 2 years. What I will say is the work is not yet over. I would actually say, in fact, I said it, I think 2 or 3 times yesterday alone, that I actually found the pandemic to be easier than what we're going through right now. Coming out of the pandemic, getting back to normal, whatever that looks like for everybody, is even more challenging. And I'm talking about for the clients as well as our staff. Just getting back to in-person for some clients, for some staff is a challenge. We still do telehealth, we still do remote things, but we've had throughout the entire pandemic, all of our housing staff have been essential. They've been on site the entire time. And really finding that balance and making sure people feel supported and can keep moving forward. I'm finding that that's even more challenging now. And now is when we're seeing the burnout. Now is when we're seeing the turnover and the hiring challenges. And the work is not over, is just what I would like my message to be. The support has been incredible, and we need to keep working. It does take a village to keep moving forward and get support for all those who need it. But thank you again for this recognition.
Thank you so much. And last, we will hear from Ms. Helga Luest.
Good morning, everyone. I'm here on behalf of the Mental Health Advisory Committee. And, we've been working on the mental health issues for a long time, but it's clear that right now is an extraordinary time of need. We know historically from single moments of disaster or whether it's a man-made or natural disaster, that 6 months to 3 years in the aftermath is when we start to see really significant mental health concerns, where we see substance abuse increase, where we see domestic abuse and child abuse increase. And we've had this prolonged experience of the pandemic, and that has added complicating factors for our kids. And I bring them out specifically because I think that children have had the not only the experience of the pandemic, but during important stages of development, when it's so important to socialize, connect, learn social norms, and they've had to isolate and be disconnected in a way. So we have a lot of learning ahead, what kids will really need to recover and build those strong relationships, build those strong social connections. I also want to call out our frontline workers and healthcare workers in particular, mental health care workers, teachers and school administrators. We're seeing attrition rates that are astounding at a time when we have extraordinary need. And so we don't have all the answers and we don't have all the resources, but we are a very strong community. And what I would encourage everyone to do is show kindness, understanding, be a listener, and contribute where you can, because there are plenty of avenues in Montgomery County to contribute and make a difference. Thank you.
Thank you. This sort of came to me as everybody was speaking, but the temperature has turned up really high right now in our world. It's overwhelming. And I think it's incumbent upon all of us to give each other some grace. There's a lot of anger about a lot of different things right now, and that's understandable. But you never know what's happening to the person on the other side that you are projecting that anger to. And that anger may be coming from a legitimate place, but we have to understand and respect each other, especially now. We have to model that behavior. So with that, my colleagues and I are going to read a proclamation together. Let's see. Whereas May 2022 is National Mental Health Awareness Month, and our nation and Montgomery County are facing an unprecedented mental health crisis across all ages, as individuals and families struggle with significant loss, grief, trauma that has been steadily mounting over the last 2 years. And
whereas 2 out of the 5 adults report symptoms of anxiety and depression, and Black and brown communities have been disproportionately impacted, exacerbating overall health disparities that include behavioral health. And
Whereas our youth have been significantly impacted, with more than 4 in 10 adolescents reporting persistent sadness or hopelessness, and 1 in 5 saying they have contemplated suicide, or emergency department report visits for attempted suicide are rising 51% among adolescent girls. And
at the core of this crisis is severe shortage of behavioral health providers and treatment options, highlighting the urgency and expanding the supply, diversity, and cultural competency of this workforce to ensure access to care for everyone who needs help, when and where they need it. And
whereas Montgomery County is fortunate to have dedicated frontline professionals and paraprofessionals across the mental health and health system who continue to serve their community through this unprecedented time. And
whereas Montgomery County is committed to promoting the health, safety, and well-being of our health and mental health workforce and provider community, and is committed to supporting a wide range of prevention and intervention treatment for the benefit in our community. And
bring it home here and land the plane. Now, therefore, be it resolved that the County Council of Montgomery County, Maryland, hereby recognizes May 2022 as National Mental Health Awareness Month and calls upon government and public and private institutions, schools, and businesses to ensure the well-being of our children, families, and communities now more than ever, and to reduce the stigma that often prevents individuals from seeking help as we align in our commitment to addressing mental health holistically and equitably. Presented on this 10th day of May in the year 2022, signed by myself and Councilmember Katz. All right, let's take a picture.